Today, I'll be removing a large, bleeding, ulcerated mass on a dog. I'm Dr. Meggs, and this is Everyday Vet. We can see here that the mass is located beneath the tail and is quite large. The mass was previously sampled and found to be a perianal adenoma, which is a benign tumor that is most common in non-neutered male dogs. Even though this mass is not cancerous, surgical removal is indicated as it is ulcerated and bleeding. Prior to the surgery, this dog had to have a bandage over the mass due to the severely irritated surface tissue. Additionally, the mass is right up next to his anal sphincter, which can result in issues with defecation. A licensed technician will be running anesthesia for us, and we also have an assistant who you will be hearing ask questions. She usually assists with medical appointments and is excited to learn more about surgery. She's planning to go to veterinary school, but since she hasn't had medical training yet, I encourage her to ask lots of questions. Seeing is the best way to learn, and I suspect that many of your questions will be similar to hers, so I hope that you find this learning approach helpful.
Who causes these growths?
They're hormone dependent. That's why the intact males are more likely to get them.
If you have seen some of my other mass removals, you may be wondering why I chose to use a scalpel blade in this procedure rather than the CO2 laser. The CO2 laser does reduce the intraoperative blood loss, however the cauterization may also delay the skin healing. With the size and location of this mass, I wanted to prioritize faster healing in order to minimize the risk of post-operative infection from fecal contamination. Normally, when using a scalpel blade, I would make a single large incision around each side of the mass in order to make an elliptical incision shape. However, I am not able to do this on this mass because of how it is positioned on the dog. The tissue in this area is very thin and fragile, and I have to be careful to avoid causing damage to local structures, such as the rectal sphincter and the anal sacs. Additionally, this is a highly vascular area, so each cut is resulting in bleeding from numerous small vessels, which is impacting my overall visibility. Stopping to wipe away the blood is certainly slowing me down, but is ultimately necessary in order to avoid making the wrong cut. As I mentioned, the anal sacs are one of the structures that I am trying to avoid while doing this dissection. Dogs have two anal sacs, also commonly called anal glands, located on each side of the anus at the 4 o'clock and 8 o'clock positions. The opening of the 4 o'clock anal sac is right next to this mass, so I have to be very careful with dissection around the upper left region of the mass in order to avoid cutting through that opening. If you look at the tail here, you can see that it has very thin hair, but it has not actually been shaved. That's just how this dog's hair is naturally growing. The thinning of the hair near the tailhead is actually a very common finding in older, non-neutered male dogs like this one.
Do they always usually rupture like that? like expose themselves?
Not always, no.
Okay.
Hades had one that stayed internal, and then he had another one that was just real small. They don't always turn into like a cauliflower type appearance, but it just kind of, some of them just behave a little bit different. But that's why it's good to have a biopsy first, because, you know, yeah, he's an intact male and he's more likely to get a perianal adenoma, but if we remove this without knowing that, we could potentially be removing a cancerous tumor with incredibly narrow margins, because due to the location, like, I'm not able to get wide around it.
And are you like able to go deep too, or not really?
I don't want to go too deep because I don't want to get into the important structures in the area.
So you're more kind of like superficial then?
Yeah, trying to just stay as much on the surface as possible.
Gotcha.
I'm just finding it in all this mess.
This vessel was bleeding more than the others because it was a small artery. When veins are cut into, the blood will flow out. With an artery, though, the blood will spray out even if the artery is very small. With this one being an artery, I'm going to need to clamp it. With my overall surface skin incision complete, I need to continue to dissect deeper in order to get underneath this mass so that I can remove it. Unfortunately, that also means more bleeding. I'm running into some blood vessels that are larger than those that were within the surface skin layer, so I will need to clamp these off. We place a set number of clamps and gauze squares into each general surgical pack based on our typical needs. Since this surgery is more bloody than typical, I am having my assistant open more instruments as well as gauze packs as needed.
Do I need to take the strips out of it?
That's okay, I can get them. These are tiny bowls.
So is it just like a buildup of like tissue or something?
Yeah, it's just an overgrowth of those cells. Tiny little skin bleeder over here. I might have to have one of you put on gloves just to keep dabbing at it for me, because I'm never going to get this out if I have to stop every 2 seconds. Okay. Do you mind grabbing, Amanda?
Yep.
While some of these vessels are large enough that I've been able to clamp them, most of them are just very tiny vessels that are resulting in an overall slow oozing of blood. They are significant enough to obscure my view of the surgical field, but not large enough that I can effectively clamp or suture them. I've been working at removing this mass while also controlling the bleeding, but it is taking too long. With a second set of hands, I will be able to go faster and reduce the anesthesia time for this dog. My incision is deep enough now that I need to switch my approach so that I can start cutting beneath the mass in order to get it removed. I've run into a lot of bleeding with my initial incision, so I expect to have the same issue as I continue under the mass. The good news is that with my margins already established, I have effectively avoided the important structures in the area, and now I just need to focus on cutting beneath that mass. Luckily, this type of growth is benign and I do not need to get wide margins. Some types of masses, such as mast cell tumors, may have irregular cells outside of the area of what is visually irregular, and the incision must be made wider in order to get all of the irregular cells that cannot be seen by the naked eye. Because of this, knowing the tumor type prior to surgery is very helpful. Knowing that this was a perianal adenoma meant that I could focus on removing the visibly irregular tissues, and I didn't have to take as aggressive of an approach. If this had been a mast cell tumor, I probably would not have been able to remove all of the affected tissue, and in some cases, that difference can determine if it is worth pursuing the surgery or not.
So what I'm mainly going to have you do is, if you want to stand behind the tail, I'm going to have you reach through and just hold the gauze up there to apply the pressure to the vessels, because it's just oozing from everywhere.
Yeah.
Just apply pressure on that there. I'm going to keep cutting. Slide your fingers up a little bit for a second.
With this step, I am trying to cut underneath the mass and maintain a continuous depth. It is very easy to think that you are staying parallel to the mass, but accidentally be continuing deeper and deeper. In order to avoid that, I am clearing away the blood to maintain my visualization of the surgical field, while also holding the tissues under consistent tension.
Right, and then slide down a little bit here to get this section.
One thing that I would like to point out here is that the technician is also wearing sterile surgical gloves. They are a different brand and style, accounting for the color change, but they are still sterile surgical gloves. Both types work just as well, and the decision of which ones to use comes down to the fit and comfort of the wearer. In some of my other videos, you may have noticed me wearing the brown gloves instead.
Stole your gauze accidentally.
With the tumor removed, we can get a good look at the overall appearance. The tumor has a very irregular, thin-skinned surface, and tumors with this type of appearance often tend to be very fragile, as was the case with this one. An ulcerated surface can bleed and be messy, but also increases the risk of infection.
Thanks. One more gauze.
And now it's science time. So let's take a look at what the perianal gland adenoma actually is. Well, lining the skin layer of the dog are glands called sebaceous glands. These glands secrete oils that lubricate the skin as well as the hair follicles. Now, the perianal gland is just a modification of the sebaceous gland, and they're found predominantly on the hind end of the dog, especially around the base of the tail. Now, a perianal gland adenoma is just going to be a benign or non-cancerous overgrowth of the perianal gland tissues. These types of tumors are more common in non-neutered older male dogs, and it's thought that androgens, which are the male sex hormones, are actually what stimulate the production of these tumors. Interestingly, estrogen, the female sex hormone, appears to suppress the formation of these tumors. So when we go to remove them, we do typically recommend neutering the dog at the time of the surgery, because if we do remove the tumor and leave the dog not neutered, the remaining sex hormones can make them more prone to developing further tumors from remaining perianal glands.
Oh, jeez.
No.
Can you grab that from me?
Yeah. Jeez, that was scary. I can just hold it if you want.
Are you able to hold it?
Yeah. Let
Sure.
me just.
Okay.
I think I can reach it. Maybe. No, I won't be able to reach
Here,
it.
let me just pack this with some gauze real quick. I was just gonna put this on for bleeding. Alright, so that's packed with gauze. I can hold this up like this if you want to go grab some tape.
The tape is over here. I'll just put this there then. That's weird.
I was not expecting that.
I don't know, might have to just take
Yeah,
it
just
off.
start from scratch. Yeah. Maybe come down a little bit more too, since the other one slid off, like come down to here.
Oh. Did you want me to go down that low?
Well, oh, actually it seems like it's holding. You might be fine with it just there.
Okay. I don't know how he did it, but...
Actually, if you just want to run it up and tape it around the pole, look that up one of these times.
While suturing, there are three main things that I have to take into account. First, I want to suture things closed such that the vessels are no longer bleeding. This can be done by either suturing the actual vessel or closing the tissues over it such that the pressure stops the bleeding. Second, I want to close any dead space. Dead space is an open area left behind since we did remove tissue from this area. The body does not like having empty pockets left behind and often responds by filling the area in with fluid, resulting in what's called a seroma. The third thing I want to do is to restore aesthetics and function. I will need to close the incision with minimal tension in order to improve patient comfort as well as to avoid distorting the rectal sphincter. And I need to line up the skin edges in order to get a good tight seal to minimize the risk of infection as well as to reduce scarring.
Alright, just go ahead and place that suture.
And now it's comments time. Ultimate Keyboard Warrior had asked about changes in urination after their puppy was neutered. Now, we can sometimes see some changes in urination and defecation immediately after the surgery, especially due to prolonged anesthetic effects, but we don't tend to see issues long term. So anything after the first day or two would be not a normal change to see after a neuter surgery. So if you do have any issues like that, I would definitely recommend checking with your veterinarian, as there are many causes of potential changes to the urination. And now it's my turn to ask you a question. So first, let's start with answering the question from last episode. And I do want to thank Bandinorial for participating. So my question was, why would you choose suturing or autoligation over the other and vice versa? Bandinorial has suspected that maybe it could be due to buildup of tissues, such as sperm. Speed was another thing that they brought up. So good points there. After we do a neuter surgery, we do have to worry about buildup of sperm, but particularly in the prostate rather than the actual tissues. So if we do autoligation versus suturing, it's not going to change sperm accumulating in the actual tissues, but we do still want to make sure to keep that dog away from non-spay females for the next month or so, as they may still have sperm stored in their prostate. Now the other part was right on the money, so speed. Speed is definitely a consideration. So when I do a cat neuter, it is faster for me to do autoligation over the suturing, and that is definitely a benefit. Another benefit of the autoligation would be that since I'm tying a knot in the actual tissues, I'm not going to be introducing any foreign material, so I'm not going to be doing anything that could potentially cause a reaction. Now on the other side of that, when it comes to a spay surgery, some surgeons, at least in the cat, will still do the autoligation to tie the vessel that goes up to the ovary, but for me that would actually take me longer. So that does come down to a little bit of surgeon preference. It's just harder for me to get that tool down into the abdomen and form a good tight knot. I find that I get a more secure knot with the actual suture, so I play it safe and I do suturing in the cat spay, but again, that one's gonna be surgeon preference. So ultimate pros and cons, one, speed, but that's gonna vary by surgeon and specific surgery. And then the other would be that we're not introducing any foreign material. So now, time for this episode's challenge question. So my question to you is, why are female dogs less likely to get perianal adenomas compared to male dogs? I will make sure to answer the question in next episode. I know that the surgery was a bit more bloody and gruesome than some of my other ones, but rest assured that the dog is doing great. He healed appropriately, and here are some post-operative pictures to show you how well that healed up for him. If you enjoyed watching this surgery, please make sure that you tune in next time when I do a bladder stone removal on a dog. I will also be going over the stone analysis and explaining how some stones form and what we might be able to do to prevent stone formation. If you want to be notified when that video comes out, don't forget to subscribe to the channel and turn on that bell icon so you get the notification. If you have any questions for me, please be sure to leave them in the comment section below, and don't forget to participate in the challenge question so that way I can give you a shout out in my next video. That's all for today. Thank you for watching. I'm Dr. Meggs, and this is Everyday Vet.
Actually came together pretty well. Alright, I'm going to take this off, and then we'll take that purse string suture out.
Want this one off?
Yes, yep. Yeah, we can undrape them now.